Hello, everyone. Thank you for joining us today. Today, we have with us Dr. Rahul Singh, a medical professional who is currently completing his cardiology fellowship at the University of Minnesota, home to one of the best medical schools in the US. Dr. Singh completed his internal medicine residency at the Houston Methodist Hospital in Houston, Texas. Dr. Singh has received numerous awards and certifications from the American Heart Association as well as the National Institute of Health. He has also published several articles and journals related to cardiovascular disease. So let's start off, Dr. Singh. How and when did you decide that you wanted to specialize in cardiology, and what motivated you to pursue medicine in general?
Yeah, so that's probably one of the most common questions that you're going to get asked in fellowship interviews, and med school as well, for that matter. And by the way, just call me Rahul.
Okay.
No, we're not in the hospital. But medicine in general, like in terms of medicine itself, I would just say that it was just the fact that I was able to help people out. I'd gone to a few medical camps and I really liked the feeling that was there. And it just, what I'd heard from physicians is that it's just a constant daily challenge and you just feel really rewarded at the end of the day. That was what drew me to medicine. And then in terms of cardiology specifically, it was the fact that within medicine, cardiology sort of had everything under whatever you could ask for in terms of seeing patients. You just didn't see patients in your clinic. You saw patients on the inpatient side on the general floor, so stable patients, and also in the ICU, so it's critically ill patients. And at the same time, you had the opportunity to do procedures. So you were in the cath lab. You got to really do stuff with your hands. And at the same time, you obviously do a lot of reading like a radiologist. So you read echoes, you can read stress tests, you read EKGs as well. So sort of gave a good mix of everything. Apart from that, obviously, I just find the heart very fascinating as an organ, and anyone in any specialty would say that they find that organ the best, and I find the heart to be sort of the most fascinating one.
Nice. Yeah, and Rahul, in terms of your residency, what did your daily schedule look like, and how does that daily schedule compare to your schedule right now?
So just to preface that by saying that every residency program is going to be different, and even in terms of specialties, every specialty is going to be different. So I did internal medicine. That's 3 years. Usually, and similar for cardiology fellowship, that's 3 years as well. And usually the way it works is that the first year is the most intense, and then as you progress, it becomes a bit easier. And in general, you usually have your yearly schedule divided into blocks of around a month each. And it depends on if you're on the inpatient side, so seeing the patients who are admitted in the hospital, they obviously require more of your attention because they're more sick compared to if you're in a month of clinic, which is on the outpatient side, and that's sort of regular office hours. So as a first year, usually in residency and fellowship, both, as a first year, usually the inpatient months are usually maybe, I'd say 7 months maybe, so the majority of the year. And that's usually at the minimum, it's usually 12-hour shifts. So usually like 6:30 a.m. to 6:30 p.m. And during that month, you only get 4 days off. So it's like working 6 days a week. So those are the intense months. And then the outpatient rotations, they're a bit more relaxed. But in general, it's the inpatient months, they start decreasing as you progress from your second and third year onwards. And as I said, the residency and fellowship schedules have been pretty much similar for me.
Okay. Yeah, and as you mentioned, the job of a cardiologist is very stressful. So can you speak to the benefits of yoga and meditation in reducing that stress?
Yeah, so that's a very good point. I personally, I don't do that much yoga. I just do like regular exercise. I used to swim a lot when I was back in Houston. Over here in Minnesota, obviously it's colder. They do have swimming pools, but it's more of a nuisance. I got a Peloton and I just use a Peloton. But I do meditate, and I started meditating when I was a child, mainly because of my parents, and they taught it to me. But what I will say is that, I mean, nobody really has to tell you about the benefits of exercise or meditation in terms of managing stress. It's just you do it and you actually feel the effects yourself. There've been numerous studies that show people having positive effects from it. It calms the mind, it controls your blood pressure, and gives you a more broader sense of organizing your life. And for me, at least, those are the effects that I've seen, that it sort of puts everything into perspective. On a daily basis, the daily stresses that I might have seem to vanish away when I put the bigger picture in mind, and really remind myself why I'm here and the passion that I have for what I'm doing. But yeah, but I think more than like listening people telling about how well they feel, it's more about doing it yourself. And then once you see how you feel, you actually start enjoying it more.
Right. Yeah. And kind of on the same topic, how do you establish the correct boundaries between work and life?
Yeah, that's a pretty good question as well. So I preface this by saying that in general, people who do medicine, they are people who are very driven, for the most part, also very career oriented. Not that other professions are, but medicine also specifically. And we're sort of known to be, yes men and yes women. So basically, people who say yes to everything in terms of taking on new projects, having our fingers in a lot of pies, so to speak, and that sort of does take a toll on our personal lives. And that's why residency is called residency, because literally that's what it was. People used to live in the hospital. Um, there is a shift now in medicine in general in terms of leaning towards more work-life balance. In terms of how you achieve it, it is very difficult. I'm not going to lie, especially when you're in training, because you don't directly dictate your timings or your schedule. It's dictated by your training program. That being said, I think the easiest way for me has been that when I step out of the hospital, I leave everything there. I don't try to chart check patients when I'm at home. If I have the weekend off, I'm not thinking about work. And most importantly is that I use up all of my vacation days. There are people who maybe pride on, not taking that much vacation. But for me, it's like I make sure that I use it on an annual basis.
Right. And outside of work, what are some of your maybe hobbies and passions that you have?
I really enjoy. I used to enjoy movie making, and just for fun. It wasn't anything serious. And I used to in med school we used to made a few short films with my friends. Obviously, during residency, when it became harder in fellowship as well to get the time. But what I ended up doing was my wife and I, we just started making travel videos wherever we go travel, or like early videos of each other. Apart from that, I mean, I used to enjoy obviously playing squash and playing table tennis, like, having the sports activities. It's a bit more difficult to coordinate that. And again, swimming used to be my other passion, but now that I'm in Minnesota, I'm waiting for the weather to sort of warm so I can at least go out to the lakes to swim.
Right. And in terms of your work, again, the field of medicine is so quickly evolving. So how do you manage to stay up to date on any new technological innovations that are in cardiology, but also medicine in general?
Yeah, that is, there are quite a few avenues to do that. Obviously, you have journals that publish articles on a regular basis. But again, there's so many journals that you sort of lose track. You obviously have the high yield ones. You have, your New England Journal of Medicine, the JAHA, Journal of American Heart Association. You have JACC, Journal of American College of Cardiology. Then you have circulation. But again, like it gets a lot. You have other modalities where there are podcasts that people make that sort of, you can just listen to while you're driving, and they try to summarize things. Then there are email like sort of send outs that people have started making as well, that try to summarize the highest yield articles of the week, especially in cardiology. That has been pretty helpful. And another avenue has actually been the Twitter sphere. Within Twitter, you have this sphere of medicine called Med Twitter. And basically, a lot of these academic clinicians are very active on Twitter, and people, showcase their research, their publications. So you can just scroll through Twitter. My Twitter feed is, I mean, it might be sad, but it's only cardiology related, only medicine related. So as I scroll through Twitter, I'm just like getting updated on the newest articles. And people know that busy clinicians don't have time, so they just make threads and they sort of summarize their whole article in infographics, so it's really easy to read. And I think that's sort of probably the future of a lot of being up to date in medicine.
Right. And I'm sure you might get this question a lot, but how can one improve their diet to improve their heart health? So what steps can someone take in order to improve their heart health?
So in terms of diet specifically, obviously there are like a plethora of diets out there. You have the keto diet, you have intermittent fasting. A lot of people are actually taking up intermittent fasting even in the cardiology world now. But that being said, I think the main issue is a personal take, but I think the main issue with all these different diets is that the reason they don't become as successful in the long term is because people aren't able to adhere to it, mainly because of the strictness of the diet. And you have short-term gains, but then once you gain them, then you tend to become lax about it, and then you lose all the benefit that you had. What I will say though is that the cardiology realm has recurrently stated that the best cardiac diet is what's called the Mediterranean diet, and that's basically the best diet for your heart that so far that we've proven. And that will just be sort of, making sure that you eat a lot of fruits and vegetables, nuts, grains, and using olive oil a lot more so than, vegetable oil, palm oil and stuff. And then cutting down a little bit on dairy products to low to moderate amounts, and try to substitute all of your desserts with, instead of using like processed sugars and stuff, using more like fruits for your dessert. Other than that, in terms of cardiovascular health, obviously, what everyone says is make sure you exercise, make sure you eat healthy. One thing that I will touch on though is that we are learning a lot about this concept of familial hyperlipidemia. What that means is that a lot of times we have a genetic predisposition to have cardiovascular disease. And so we might see patients who've been very adherent to the lifestyle factors, but yet they still have heart attacks at a young age. And it's actually just in their genes, and it's a family history of it. And unfortunately, there's a lot also in the South Asian population in terms of genetic predisposition. And so in order to combat that, it will just be, making sure that once you're an adult, to get plugged in with a primary care provider and make sure you follow up with your doctor on a regular basis.
Yep, that's great advice. Yep. And one final question for you. So humility is central to your profession. So in the future, how will you ensure that you will remain open-minded and grounded?
So yeah, I think it's at least in training, it's a very daily thing, because you realize how much you don't know on a regular basis, and you get reminded that probably on an hourly basis. But obviously, once you go into practice, I think it's just the patients themselves, because you realize that you're taking care of people at the end of the day, someone's mother, someone's father, and just the fact that you're able to make a difference in their lives, that itself is very humbling. Along with the fact that the more you learn, the more you know that you don't know. And even as you get more super specialized and you form your own niche, you tend to forget about the other general parts of medicine. And that itself is humbling, because then you might know one thing really well, but the hundreds of other things you actually have no clue about. And I think that's very humbling, and I think that's what's going to be driving me in the future.
That's a great piece of advice. And thank you very much for your time today. And thank you for all you do for patients and the healthcare industry as well.
No, thank you. Thanks for having me.
No problem. Yep, this will surely help a lot of high school students and even college students, gauge where they are in terms of achieving a successful medical career. So I think this will be really helpful for everybody. So thank you.
Thanks a lot.